Hello, everyone, and thank you for joining the FP 2020 and Partners webinar on the Post-Family Planning Vision Framework. We really appreciate your input and the time that you're taking to be with us today to learn more about the global consultation, the things that we've been hearing from everybody, and the path forward to co-creating the next iteration of the Family Planning Partnership that will take us to 2030. So the first thing I'd like to do is to introduce to you the things that we're going to talk about today and that we're going to share with you. And then we'll end with the path forward for how we'd like to hear more feedback from you about what to do next. So I'll be sharing with you, along with my colleagues from Deloitte Consulting, what we've heard so far from the global consultation. From that, we'll share with you the latest iteration of what we're calling our vision framework that we'll be building the new partnership around over the next year or two. And then we'll explain to you what that pathway looks like and how it is that you'll be able to participate along with us to help build this new iteration of the partnership. So I want to start first with what our objective has been. And it's really that we feel very fortunate this time that we have a partnership that's up and running. We all know each other. We've been working together now through FP 2020 since 2012. And so our objective is really to use the next year or two together to continue to learn and to continue to shape the next iteration so that we're building from a place of success. We know what it is that we're doing through partnership now. We want to explore together the opportunities for expansion, to look at gaps in the system and make some agreements together about where we will put our emphasis and focus as we move toward 2030. But we're really doing this from a position of power and partnership based on what we've already built. And we want to make sure that the decisions we make don't disrupt the work that's already taking place. So that's why the Core Conveners of FP 2020, who are the Bill and Melinda Gates Foundation, the UK Department for International Development, USAID, and UNFPA, have committed to this long sort of transition process and co-creation process over the next few years, so that whatever we build together and whatever agreements we have are smoothly transitioned from one to the next, providing a lot of space for everybody's work to continue as it is that we shape new directions that we may decide to go through together. This consultation is intended to spark an additional level of conversation and again to create more opportunities to hear from all of you about where it is that we'd like to go with the partnership from here forward. Some of the things that we want to make sure we get right is that even though this is a donor-funded initiative, we believe that our success is measured by what happens in each of our partner countries and in the lives of the individual women and girls that we all seek to serve. So some of the things we want to ask ourselves through this process is, are they getting the services they need? Are the perspectives of the women and girls we seek to serve and their needs, are those perspectives and needs well understood? Are they taken into account and are they addressed? And can we position this partnership so it's truly driven by countries, so that country programs and the goals that they have are advanced and supported? Again, with countries always in the lead and always solving for that is the area that we want to move forward. So with that, I want to introduce my colleague, Hannah Patterson from Deloitte. And Hannah is going to share with you the consulting process to date. Once Hannah's done sharing that, then I'll introduce our vision framework and the direction that we're hoping to get your feedback on today. So Hannah, over to you.
Great, thank you so much, Beth. So as Beth mentioned, this process was really intentional about including the community and making it a very collaborative vision statement for the future. So this started back in January of 2019, where we identified a large group of stakeholders who we really wanted to have included in the process, and we spent most of the winter time engaging people in a number of different ways, which we'll get into a little bit more in the coming slides. Then in the spring, we really took the information that we received from the community, analyzed the data, synthesized the findings, and used that to work with the core conveners in FP 2020, along with a reference group, to start to draft an emerging vision statement and some potential focus areas for the future of the family planning community. We shared an emerging vision in June at Women Deliver, where we had attendees both from the reference group as well as the broader community, and provided an initial opportunity for everyone to provide their feedback on what had been drafted to date. That feedback process continued over the summer with content that was posted online through FP 2020's website, where community members were able to share their thoughts and insights on the content that had been created to date. The core conveners, along with FP 2020, worked to refine and kind of revamp the vision a bit based on community input. And then we are re-engaging in a socialization process here this fall, all in the lead up to the Nairobi Summit in November, where we will share a revised version of the vision based on this additional round of feedback that we're receiving from the community. So what did we actually hear and how did we engage with people? So this slide here actually shows the geographic representation of those we communicated with and received input from over the course of this community engagement. So in the very first stage of feedback, we had over 1,000 stakeholders who were consulted, and we did these consultations in a number of different ways. Some of them were done through individual interviews, where we actually had one-on-one time with a person to gather their thoughts. We did in-person focus groups, where you can see a variety of locations on this map, where we actually gathered a group of approximately 20 to 40 people to share their input. And then we also had an online survey that was hosted through FP 2020's website, where individuals were able to go and provide their feedback as well. So this slide shows where the respondents reside from an organizational perspective and the years of experience that they have in family planning. I want to call attention to the family planning experience because we were very intentional. You'll see the average respondent had a lot of experience, but we were very intentional about also engaging individuals who maybe work in fields that are related to family planning. And so you can see we had about 5% of the respondents who actually don't have experience in family planning directly, but we thought it was really important to hear from others in the development community about where they think family planning should be focused in the next decade and how and where are there opportunities to work more collaboratively going forward. You'll see a word cloud on this slide that actually captures the feedback we heard directly from the community. So part of the surveys, virtual focus groups, in-person focus groups, and interview process actually asked individuals to articulate in their own words what they thought the vision for 2030 should be. And so here you'll see the words that are largest. Those are the words that we heard most frequently or saw most frequently articulated when we actually asked community members to provide their specific input on that vision statement. So we see that women are very important here. People are very focused on methods and contraceptives and having the services that individuals need. We also asked individuals to respond with how they thought the community would be able to support and make this vision a reality. So these are some of the focus areas that respondents felt were important in order to enable a future world where family planning has been able to achieve their vision. And so you'll see here that youth is very prominent. The countries aspect, which Beth has mentioned earlier, making sure that countries are really taking a strong role in what this future looks like. And so these things you will see emerge as Beth shares the actual vision statement and focus areas that we have currently. So Beth, I will transition back over to you to share the actual vision.
Thank you, Hannah. And thank you for the partnership with Deloitte. It's been very productive. So now I'd like to share with you our vision framework. And before I go into the specific elements of it, I wanted to introduce how it is that we've been conceptualizing this. So we're sharing with you what might look like a somewhat complicated matrix to start out with, but we're going to take time today to walk through each element of it so that you can come along with our thinking and help us to ascertain if we're heading in the right direction. So the things I'm going to present to you in the coming slides will be a focus on the vision framework, a timeline around the tagline itself and when we'll be developing that, vision statement, which is the goal, which demonstrates the core concept of what it is that we're trying to achieve through the partnership. We'll talk about the result statement, focus areas, the objectives, and our guiding principles. So let's start with the vision framework itself. So first to say that we recognize the importance of having a tagline, something sharp and pithy. With FP 2020, we had the goal of reaching 120 million additional women and girls so that they can make the decisions for themselves about if, when, and how often they want to have children and to use the contraception they want to use. Now, I obviously expanded that over time. It expanded with FP 2020. I think we're most known for the 120 million user goal, but we want to develop a tagline that's equally memorable, and we'll be doing that over the coming year. But what we do know is that we're not going to make that a numeric goal, but something that we can all agree will motivate our work through to 2030. So let's look more closely at the vision statement itself. The ideas that emerged from the community were grouped by themes to guide development of vision and focus areas. And the statement is meant to convey the core priorities of the partnership. The final vision statement includes revisions proposed by the community and reads, working together for a future where women and adolescent girls everywhere have the freedom to make their own informed decisions about using modern contraception and having children, lead healthy lives, and participate as equals in society and its development. It's meant to convey those same themes in a manner that is inspirational, widely accepted, can be adopted by country governments and global donors, and instills an urgency that compels action for the post-2020 period. So let's go ahead and break down some of the elements of this statement itself, because we tried to use the language here as signifiers of important areas of intent and intentionality within the partnership itself. And let's start with the focus on women and adolescent girls. We see this as being key to achieving SDG 3 and 5, and the focus on access to contraception and family planning as a method of empowerment for women as well. That's not to the exclusion of men and boys. We certainly will be working with that as well, because men and boys have reproductive health needs as well, and they're key partners in relationships and supporters of women and use of contraception. So while we will measure for women and girls and have an intentionality there, it's meant to be a broad partnership approach. We also want to make sure that we focus on adolescents in particular, because we know that this is the group with the highest rate of unintended pregnancy and the highest rates of STIs and HIV. So by focusing on the needs of adolescents, we'll be focusing on those who are in greatest needs as well, and also recognizing that this is the area where we're often seeing people most left behind. When we look at the term freedom, this is where we want to bring in the rights agenda, because this is where we see that people have, through freedom of action, the opportunity to really access and use. And it's the action based on that capability to realize your own reproductive intentions that's so critical to the success of this movement. We also thought about how this links with the sustainable development goals and concepts of sustainability. And this is where we wanted to reach into that concept of women's empowerment and how that links to society, its development, and sustainability itself. So again, when we get to the decisions about having children, this also includes the opposite side, which is that women often don't want to have children at a particular time in their life, and they should have access to contraceptives and the contraceptive method that's going to work best for them if they want to avoid or delay pregnancy. So that's captured in here as well. When we go back to the phrase informed decisions, this is where we get to the concept of rights, but also the systems that need to be in place for women and girls to have information both about biologically what's happening with regard to their bodies through reproduction, but also what are the systems of education that need to be in place for them to know about and be counseled on the various methods so that they can make an informed choice at the time that they're with a service provider. And then meeting that choice with a range of high quality methods so that they are available and accessible at the time that a woman or girl wants to use them. And then lastly, I want to end with the concept of everywhere, because we see this as being both inclusive of all countries in terms of the breadth of what we aspire to achieve, but also all people within countries. One of the areas that we've been working on most intentionally in the last 3 years through FB 2020 is making linkages to humanitarian sectors, but also people everywhere who are marginalized and vulnerable. How are we going to reach those and balance that need against improving systems for quality as well? There's some tension in that deliberateness there. And so we're going to need to focus on how it is that we reach everyone while also maintaining and growing services that are already up and running and available to everyone. So it's quite a complicated statement, but we hope that it captures the intentionality around all of those desires within that. So let's go next to our guiding principles. And these are the areas that the partnership is really seeing as foundational to everything that we're going to do going forward. And as you'll see on this slide, they undergird everything within the framework itself. So on this slide, we're going to break down each of these guiding principles. And here's where you'll see, next slide, please, that we are going to keep a person-centered, rights-based approach at the core of everything that we do, so that women and girls are able to act on a voluntary desire to use or not use contraception in order to manage their reproductive lives. Again, we get back to the concept of focusing on women and girls, but engaging men and boys and communities, and ensuring that, for example, as new contraceptive methods are developed for women and girls, that they're also being developed for men and boys. We see great growth opportunity there as well. We want to continue to work with and to better understand the needs of adolescents and youth and other marginalized populations to make sure that we're understanding their needs, that we're able to gather evidence that will inform our decision-making about how to approach our efforts, and that we're partnering with people from these specific communities so that they have a seat at the table and can help to shape programs and policies at the country level and at the global level. And then lastly, we want this partnership to remain a country-led global partnership with shared learning and mutual accountability. And that means that we're surfacing opportunities for better partnership with country partners so that those who are at the global level or at the donor level are making better informed decisions based on a smarter understanding of what the needs really are in countries. And this is why we've put this webinar together today too, as one of our first steps in really reaching out to country partners so that we are capturing your thoughts and your ideas about how this partnership can be as high impact as possible. Next slide, please. So the following slide will really focus on our focus areas. And this is where we're going to look closely at each one of them. And remember that these are based on the word cloud that Hannah showed you earlier, where the community believes that we can have the most impact through partnership. And they will be the key priority areas for engagement for the next iteration of our partnership going forward. So let's look at these a little bit more closely. The focus areas are the thematic areas, again, that the partnership has chosen to emphasize. There was a strong consensus that the focus areas should reflect the most critical components of the ecosystem that will accelerate progress on family planning and will drive the greatest impact. This next phase of the partnership will drive innovation within these key areas with a focus on creating solutions at scale that are sustainable. So the first focus area we're going to look at together is on expanding the narrative and shaping the policy agenda. This partnership, including the Secretariat, has raised awareness of the critical role family planning plays to achieve broader health and well-being outcomes. In the next decade, we hope the partnership will further evolve the narrative for family planning, It'll refine and reposition family planning as critical to improving individual prosperity, universal health coverage, human capital outcomes, and advancing the gender, health, and women's rights goals. We also believe it should focus on efforts to ensure countries have the best available evidence to make informed decisions on policy to strengthen family planning programs, and that those policies are fully implemented. This is another area as well where we know we can expand partnership to other sectors that are both affected by a woman's ability to make decisions around her fertility, as well as areas where we see an opportunity to engage women as contraceptive users as well. Building on the foundational work of the demographic health surveys, the DHS, and other key data sources, FB 2020 data partners have developed new methods for analyzing data, increased the capacity of data users, and established a reporting process that allows countries and partners to use data to better track, process, and make decisions. In the future, the goal is to expand this work to ensure data is timely, key gaps in data are filled, and greater capacity for data use is built at the country level. This requires investments in data systems, human capacity and training, as well as ongoing experimentation with new methods for collection, analysis, and use. Our next focus area is to increase, diversify, and efficiently use financing. This partnership has long placed value on increasing the overall funding available for family planning, both at the global and the country levels. Looking forward, this work will be targeted to help foster resilient and sufficient financing. A combination of country-led domestic resource mobilization, targeted emphasis on the role of the private sector, including better understanding out-of-pocket expenditures, and ongoing donor funding will create a more holistic approach to financing. UHC, or Universal Health Coverage frameworks that promote family planning as a key element of primary healthcare systems and that provide holistic, integrated services will be a key to that sustainability going forward. Vertical programs and models will not meet the range of reproductive health needs. Sustainable funding of integrated systems will be a key driver of success going forward. We'll also look to transform social and gender norms. As we all know, social, cultural, and gender norms significantly and directly affect the ability of women and adolescent girls to control matters related to their reproductive health, to adopt healthy reproductive health behaviors, including the informed and voluntary use of modern contraception, which in turn has an impact on their overall health and well-being, as well as that of their family, their communities, and their countries. In addition to addressing the barriers between women and girls and access to a full range of modern contraceptives, programs must support advocacy and support interventions that address harmful norms and practices, such as early marriage and gender-based violence, as well as positive norms, such as keeping girls in school, involving men and boys as healthy partners in contraceptive use, and promoting the healthy timing and spacing of pregnancy. The partnership will increasingly emphasize efforts to promote positive normative change. We'll also seek to improve system responsiveness to individual rights and needs. This partnership has long recognized that quality of information, services, and supply is crucial to long-term success. In this post-2020 period, the partnership will continue to expand its work in this area, encouraging the development of systems that are responsive and accountable to meeting the needs of all, women, men, adolescents, and youth, no matter where they live or their economic status. We will focus on women and girls, but again, we must also work more effectively to meet the reproductive health needs of men and boys, and to fully engage them as partners and contraceptive users themselves. We'll also focus on meeting the needs of those living in fragile or humanitarian settings, truly operationalizing the catchphrase, "No one left behind." This includes focusing on all marginalized and vulnerable groups. We will also be looking at a user-centric approach to improve market dynamics to help pave the way for healthy and sustainable family planning services and products in the long run. Support for family planning is an essential part of emerging funding mechanisms, including the initial benefits packages on the path to universal health coverage. So, what happens next? We're going to continue to gather input from all of you about how what we're presenting today sounds. Are we heading in the right directions? And then we're going to be refining this again based on any edits that come forward from this part of the consultation. We're going to share the next iteration of this vision with all of you at the Nairobi Summit in November of this year, and it'll also be available online. So the consultation will be online and the launch will be online as well. And then we're going to start working on a transition roadmap and looking at the partnership approach. We see this vision framework as being the what it is that we want to accomplish. But then there will be the next question, which is how do we want to accomplish it? What is the shape of our partnership going to look like? And will we be challenging ourselves to take new approaches in order to achieve them? So we're going to be, as of today, launching a website for all of you to go to share your thoughts about this phase of the partnership. So we have a web address that we'll make available to all of you so that you can go and share your feedback immediately after this webinar if it's convenient for you while thoughts are still fresh. Or if you need more time to think about it, please do. These questions, this website will be available for several weeks. So the questions that we're hoping that you'll help reflect on are really about how does this vision resonate with you? Have we hit the right things? Is there anything unique in here that you think is important to really drive on? What are we missing? Does the vision meet your expectations of what you thought the next family planning partnership or vision would look like? If not, please tell us. If so, please let us know what areas you think are really working. And how inclusive do you think this vision is for all partners that we want to bring to the table? So we're going to continue to focus on working with the countries where we see the most need for progress. But we also want to make sure that this process aligns with the SDG concepts of universality, so that as we remain focused on family planning and focused on family planning in key areas, we're also being inclusive enough that everybody can see their family planning objectives within this partnership. And finally, how well do these guiding principles align with your core beliefs about how family planning should be addressed? So again, this is just one more step in the process of consultation. We'll continue to work with all of you in the lead up to Nairobi. We'll get your feedback from Nairobi, and then we'll start to talk about how it is that we're going to implement all of this. FB 2020 is going to continue through 2020 and into 2021 through whatever transition phase is devised, and all of you will be a part of that process of creating the new partnership and fully understanding what that timeline for transition is, so that when it comes to the time to transition to some new ways of working, we do so smoothly and fluidly and with the understanding and buy-in of the family planning community. So there aren't any disruptions in the system, but rather this continuous partnership and support to one another through partnership that brings us forward to 2030. So I want to thank you for being with us today. I want to thank you for your interest and the time that you spent. And we really thank you in advance for going online and taking a few minutes to share your reflections based on the webinar today. And we look forward to working with you to continue to build this framework and to build the partnership to 2030 so that we can bring successful family planning programs to every country in the world. Thanks again, and we look forward to hearing from you. Goodbye.